I have muted everybody and I have started recording. We'll start the lecture now. So today we will see the remaining aspect of philosophical background of Kant repertory. So far we have seen the three basic principles on which Dr. Kant has evolved his philosophy. That is, man is prior to the organ expression of whole is important, central disturbance and peripheral disturbance, proper understanding, proper reflection of these two terms. And further, Kant has also said that the pathology is the end result. So there is not much scope of pathology in selection of homeopathic remedy, and also there is no scope for pathology in totality of symptom because it is the end result. And then on the basis of these three principles we have studied that Kant has basically five important philosophical background. First is a prime importance to mental general, second importance to physical general, third importance to characteristic particular for differentiation, then limited generalization and limited value to the concomitant symptom. And yesterday we have seen prime importance to mental general. And while dealing with this philosophical background, how important it is to understand the mental general of a patient we have understood, and among this mental general, which mental generals are more focused by Dr. Kent, that we have also seen. Dr. Kent gives importance to symptoms of will and emotion, symptoms of intellect, symptoms of memory, and among all this, maximum importance is given to positive emotional modalities. Today we will see, and we also seen that among the mentals, rather than common mental symptoms, the qualified mentals, that is mentals with some kind of modality, some kind of modifying factor, and mentals along with and mentals along with some concomitant symptoms are given more important. And so whenever there is an attempt to find out the homeopathic remedy for the patient, rather than giving importance to common mental symptom, the qualified mental symptoms should be given more important. And Dr. Kent advises that whenever we are finding out the remedy, our first focus, our first condition is that we will not think of a remedy as a simillimum unless it covers this important mental general of patient. And after mental generals, now Dr. Kent gives his second principle. So that means what? Few remedies will be eliminated. For example, if there are 2000 remedies in our Remedica, so depending upon the mental symptoms present in the case, we will consider only those remedies which have covered the mental symptom for next stage of consideration of finding out the simillimum. So in this way, in this first philosophical background, Kant eliminates a large group of remedies of homeopathic mathematica which are not indicated for the case as they have not covered the important aspect, that is the mental symptom. Then the second importance is given to the physical general. And why this importance is given to the physical general? Because Dr. Kent was already not satisfied with overemphasis given to the part by the Bonhoeffian philosophy, and therefore he has neglected those expressions of part, and he has said rather than expression of part, what is more important is expression of whole person. And why this expression of whole person is important? Because this whole, 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 is more nearer to the man. It is more belonging to the central disturbance. And unless your remedy covers this central disturbance, again, there are less chances of cure for a specific patient. And accordingly, Dr. Kent has included this, this physical generals also as part of central disturbance. And then further he explains what does this term include. What does this physical general include? It includes mainly sensations and complaints in general. Now what does it mean? Sensation and complaints as applicable to whole body and not applicable to the part. So to understand sensation and complaints in general, we will take example of sensations and complaints in particular. Then in context to that sensation and complaints in particular, we will be able to understand sensation and complaints in general. So burning pain in eye is a sensation pertaining to the part. Watery discharges from eye is a complaint related to a part. And burning in the eyes, burning in the nose, burning in the throat, burning in the abdomen. So this is a common sensation which is present in more than two different parts of human being. And this sensation, as it is common to two parts, it should be considered as a sensation which is applicable to whole person. And then that burning in the second example, it will be considered as a physical general. If there are discharges from the eyes, there are discharges from the nose, there are discharges from mouth, there are discharges from skin. And when this discharges is common to more than two different parts, it do not represent different parts, but it represents the whole person, and accordingly it should be considered as a complaint which is related to the whole body. And this sensations and complaints in general is part of central disturbance. Do not confuse with sensation and complaints of related to part. Then aggravation and amelioration in general. Again, to understand this, we will take one example of aggravation and amelioration to a particular part. So by the time it is very clear that general means whole body, general symptom means whole body, and particular symptoms means part of body. And accordingly, any aggravation which is related to the part, it is a particular modality. For example, burning in eye better by going in the open air is a aggravation related, it is a amelioration related to eye. But burning in the eye, aggravation in the open air is aggravation in particular. Burning in the eye better in the closed room is amelioration related to part. But when this aggravation in open air and better in the closed room is also present in or in relation with symptoms of nose, in relation with symptoms of mouth, in relation to symptoms of gastrointestinal tract, or in relation to the symptom of skin, then it will not become or it will not limited to the level of part. It will then reflect, it will then applicable to the expression of whole body, and then it becomes general. And then this aggravation, amelioration, which is applicable to the different parts of the body, which is expressing or which is representing the expression of whole body, then it is considered as central disturbance, and then it is given its importance accordingly. Then third, desires and aversions with respect to food. Now there is a little controversy about this desires and aversion to food. And the controversy is that there are some authors who are having the opinion that this desires and aversion with respect to food should be considered as a mental symptom because it is related with the will part of the mind, and anything which is related to will part of mind, it should be considered as a mental symptom. And some authors say that the desires and aversion with respect to food should be so far we have seen sensation and complaints in general is a part of central disturbance. Aggravation and amelioration in general is also related to central disturbance. And then desires and aversion to food. Some philosophers, some authors say that it should be considered as fourth grade mental general symptom because it is related to the will part of mind. And mainly Dr. Margaret Tyler, direct student of James Tyler Kane, was of this opinion. But some author says or some physicians have the opinion that as this desires and aversions is respect to the is at the level of body, is on the plane of physical plane, it should be considered as a physical general. I think you have understood these differences of opinion between this desires and aversion to food. So out of these two opinions, as most of the examiners follow this opinion that desires and aversion to food should be considered as a physical general, as it is the expression of will on the physical plane. You also continue with this understanding for the purpose of examination, but at the back of your mind, you also keep this in your mind that desires and aversion to food can also be considered as a grade 4 mental general symptom. Then next thing to consider under physical general is symptoms in relation to sleep. Now why it is considered physical general? Sleep is considered as a physical general because whenever we are in sleep, the whole body, right, and the various systems are involved in the mechanisms of sleep, in maintenance of sleep. So sleep is not only related with central nervous system. There are multiple signals. There are multiple feedbacks for induction of sleep, and there are multiple factors which are also responsible for continuation of sleep. So as sleep also reflects the expression of whole body, it is considered closer to the central disturbance. It is considered closer to the will and understanding. It is considered closer to the man, and therefore it becomes part of central disturbance. The next thing to it is considered is menstrual and sexual symptoms. Now, why menstrual symptoms are considered under physical general? Why not it is considered under particular symptom? Now, there is again a slight difference in between which menstrual symptoms should be considered as a physical general and which symptoms or which menstrual symptoms should be considered as particular symptoms. So menstrual symptoms independent of any pathology related to female genital organs will be considered as physical general, and menstrual symptoms dependent on certain pathology of female genital tract, it will be considered as a particular symptom. If you read the preface written by, if you see the introductory part of Margaret Tyler and John Weir article repertorizing, in this it is very clearly mentioned that all menstrual symptoms are not physical generals, and all menstrual symptoms are also not particular symptoms. You have to apply your knowledge of pathophysiology, you have to apply your knowledge of obstetrics and gynecology, and you have to conclude whether this symptom is reflecting the whole man or whether this symptom is reflecting a particular part of body, and more away it is from the part of, it is away from the whole body, it will be symptom of part of the body. To just clear you with the example, we'll say, so irregular menses, and if there is a cyst in the ovary, if there is a big cyst in the ovary, how we are going to analyze this symptom? So this irregularity is dependent upon certain pathology of ovary, and therefore this symptom will become particular symptom. On the contrary, the menses are irregular, everything is investigated and there is no cause is found, then it becomes physical general. Then one more example I will take, profuse copious menses in presence of fibroid of uterus. It will become particular symptom. Copious excessive menses in case of dysfunctional uterine bleeding, it will become a particular symptom. But in absence of DUB, in absence of fibroid, this peculiarity will be considered as a physical general. So remember this controversy, remember this opinion, and we will again discuss it whenever time permits. But for the timing, you remember the menstrual symptoms independent of pathology of female genital tract are considered as a physical general, and as it is reflecting the whole body. Now, why it is reflecting the whole body? Because in our if you study the endocrinology, that there is a hypothalamo-pituitary ovarian axis. I'm again repeating, hypothalamo-pituitary ovarian axis. So in the endocrinology, it is very clearly mentioned, and the menstrual symptoms are most importantly, they are correlated with this hypothalamo-pituitary ovarian axis, and therefore it involves more than two systems. So it is considered as a physical general. And then the sexual symptoms. Now again, the sexual symptoms, especially desire for coition, aversion to coition, all this is again related to this hypothalamo-pituitary ovarian axis, and therefore it reflects the expression of whole body, and therefore it is more closer to the man, and it is a part of central disturbance. So this various categories of symptoms are considered as a physical general, and they are even respect by considering it as they are reflecting the central disturbance. And while giving consideration to this physical general symptom, which physical general should be given more importance? Kent again gives a clear-cut guideline. Again, emphasis is given more on the qualified physical general symptom and not the common physical general symptom. Now, physical general is a physical general symptom reflecting the expression of whole body. But for the purpose of giving importance, we have to identify which is the qualifying physical general symptom. For example, thirst is the physical general, patient is thirsty is the physical general. And what are the further qualities of this thirst? That patient is preferring ice cold water. Its quality is specificity of that thirst. That thirst is frequently at every 15 minutes interval that patient is taking large amount of water. This is a qualifying condition for that thirst. And the thirst is more in the heat stage. Thirst is more in the sweat stage. So all such qualifying conditions will make that physical generals more important, and this such qualified physical generals will be given more importance. And further, Dr. Kane says that one has to consider only those symptoms, only those medicines which have covered the physical general symptom for next stage. So this is the second stage of elimination of remedy. The first stage, out of 2000 remedies, consider only those remedies, those medicines which have covered mental general symptom. So for example, it is now 354 medicines which cover the mental symptom. Now in the next step, we are going to cover only those medicines which have covered the physical general. So, and then we have studied the case, and we will further narrow down this list of 354 medicines, and we will say now we will only focus on the 200 medicines which covers mental general and physical general. And then Dr. Chen, in his third philosophical background, he gives guideline that how we are going to choose the final medicine once it has covered mental general, it has covered physical general, and the medicines which covers mental general and physical general, they are further differentiated with the help of characteristic particular symptom, and the medicines which covers now mental general, physical general, and characteristic particular, are given more preference in becoming the or in selecting the final medicine. So this is the third philosophical background, characteristic particular symptoms for finer differentiation. Then we have understood what is general symptom, and then we have also understood what is particular symptoms. So particular symptoms are symptoms related to the part of body, and whenever there is a derangement of vital force, whenever there is a journey from health to disease, we see certain particular symptoms which are not related to disease, but they are away from disease. For example, diarrhea, acute gastroenteritis is the disease. Okay, and the symptom burning after or burning in the rectum after passing stool. It has nothing to do with this pathophysiology of acute gastroenteritis, and accordingly, it has given higher importance following this guideline. What is this guideline? The particulars which are not related to disease, but they are away from the disease, they are given more important. Now, this is the thumb rule or the golden rule for selecting or for identifying the importance of symptom. The more away a symptom is from pathophysiology of disease, the more a symptom is not related, it is given the higher importance. And accordingly, the characteristic particulars are those particular symptoms which are not related to disease, but they are away from the disease. So such characteristic particulars which are present in a case, they should be used for the differentiation of remedies which are revealed through the mental general and physical general. Then one very important caution about the use of this characteristic particular. Now, in the previous topic we have seen, Dr. Kent was not happy with the use of this particular symptom as a keynote. And Dr. Kent says in the earlier philosophical scenario at the time of when Dr. Kent came into the field of repertory, we have seen that that was one of the important drawback at that time. The characteristic particulars or the keynote, there is an abuse of this particular symptom. And what is that abuse? Now that abuse of the particular symptom, I will explain you. That the philosophy of Kant says we have to respect to the totality of symptoms and not respect to the peculiarity of single symptom. For example, there is a case with few symptoms and all the totality of symptom it indicates to say medicine like arsenic and chamomile. But there is a one very peculiar symptom that the patient is having pain in the abdomen, which is better by bending double. You understood? There is a case, totality of symptom is taken. It indicates two medicines, arsenic and chamomile, and there is a one particular symptom which is very, very outstanding. That patient during the episode of pain in the abdomen is relieved by bending double, and then this peculiar symptom is given maximum importance and the rest of the symptoms are neglected, and this peculiar symptom becomes the only indication of selecting the medicine, and prescription is made on this point. Then Kent, while discussing this characteristic particular, has talk about the first grade general symptoms. Uh, that first grade general symptoms are those general symptoms. They are basically the particular symptoms, but there is a opposite modality to this particular symptom. For example, all the complaints of arsenic are relieved by application of heat, except the head symptoms are relieved by application of cold. So throughout the remedy, amelioration by heat is a general modality, but this particular symptom of headache is relieved by cold. So there is a peculiar contradiction of modality. There is a peculiar contradiction between the general modality and particular modality, and this contradiction between this modality is very, very important. And Dr. Kane says that this peculiar contradiction should be considered as general symptom and it should be considered as a first grade general symptom. I will explain you in this next short meeting. One more point which I want to cover in this meeting recording is further Dr. Kent gives advice that if your remedy is covering mental general and physical general, but it do not covers a particular symptom, don't worry about such particular symptoms which do not follow physical general and mental general, and you can go ahead with your prescription only on the basis of mental general, physical general, and neglecting this particular symptom which not fits into the case.